Let's talk about Chapter 3, Medical Surgical Patients as Individuals, including their families and communities. So get your book, marker, and some paper, and we'll take some notes. So the health illness continuum. So the traditional views of health, this is a continuum, and a continuum is like let's think of a long line. At one end is pure health, total health, and at the other end is very, very sick. So the traditional view of health is that they waited till you were sick and then you got treated. In fact, appendix may burst and then you get treated. A lot of people didn't survive that. That's why there were a lot of children that died young back in the day. But the current view of health and illness is that we want to prevent illness. So we work on regular checkups and booster shots and flu shots and regular pap smears and just try to stay healthy. That's the current view. Don't wait till you get sick. Exercise, all those kind of things that help us stay healthy. Now, a typical dictionary definition of health is soundness, especially of body or mind, freedom from disease or abnormality. And that's from the American Heritage Dictionary. But we have more definitions of health because there's cultural differences too that we have to take into consideration. Cultural differences have different definitions of health. The common concept of health as a continuum ranges from optimal wellness, as I was saying, and illness or death at the other end. So the current view of health and illness, differing from the traditional view, is that even patients in long-term care, they can vary in not too bad of a condition to really bad condition. And it can change from day to day, week to week. So they're on a continuum, and it's continuously changing. In American culture, disease is regarded as a disruption of biologic and or psychologic function. So sometimes a patient can seem very healthy in body, but their mind is not healthy. And vice versa, a patient can be very ill, but very sound of mind. So that's another range of continuum that we have, mental and physical. Disease is a condition that can be recognized through objective findings, like fever, presence of bacteria, or an individual's inability to perform social roles. Illness, however, has a broader definition than disease because it incorporates personal, interpersonal, and cultural perceptions of and reactions to disease. So what we want to think about, and what's really important to remember, is that our healthcare focus right now is prevention of illness. And on page 25, it talks about medical surgical patients include patients on this continuum of health and illness. And nurses engage in health promotion, like just getting a patient up and moving around can help them get better, can aid in their health. So we can prevent maybe a pneumonia. We also manage acute and chronic health deviations. So if you remember, maybe in fundamentals you learned about acute illness and chronic illness. So I'm going to talk about it now, and it'll probably be mentioned several times in the lecture. So an acute illness is something that occurs suddenly and then goes away. A chronic health condition, however, can stay for a really long time. It's like COPD or asthma. And I'm not talking about allergic asthma that just comes and goes seasonally, but something where you just have a chronic condition that's just there all the time. Diabetes is another example. A common cold would be what? Acute, right? All right, so on page 25, it also talks about health illness continuum. and that is a variation of health or illness. So not absolute health or absolute illness. I know I was a little repetitive there, but that's okay, right? So hospital health care, the hospital environment is often unfamiliar and frightening. Patient comes in, they might be very sick when they come in. So when they start getting better, they're in unfamiliar surroundings. They don't even remember getting there sometimes. And it's frightening. They might be alone in a room in isolation. So we have to be very sensitive always to these conditions. And sometimes even going to the hospital can be like traveling to a foreign country. It's sterile and cold, and different language may be spoken. So the other thing that happens in a hospital is patients are separated from their family and friends. And I know right now in this COVID situation, if a patient goes into the hospital, they are not surrounded by their loved ones. They do not have that person that follows their health care and makes sure they're getting the things that they need. That's pretty scary. Language barriers can complicate the process of providing care. If you don't understand what your patient is saying, how can you help them? So that's why we have interpreters, why we have family members that stay with people that speak another language. And sometimes, if you're lucky enough, you might have another healthcare member that speaks the language. Now, the problem that can happen here is that even if it's a family member speaking the same language and can interpret, they may not know the medical language. So it's hard to explain. So that's why we like to have a medical interpreter, so that they can translate a medical word into a word of the language so the patient understands. So culture shock can occur during a hospitalization. You're used to maybe living with a lot of people, and suddenly you're in a room alone or with another person that doesn't even speak. Or a curtain is pulled. You don't even see anybody. And maybe someone only checks on you every once in a while. So we have to always be sensitive to a patient when they are admitted to a facility, to the foreign land. So community settings such as physician's office, outpatient clinics, community mental health centers, home health care, hospices, and daycare centers, those are all very helpful in providing health care to our patients. Sometimes patients have their own health care network, like spiritualists or curanderos or root doctors. And many ethnic or cultural minorities have difficulty getting through the maze of health care services. Heavens, it's impossible sometimes for me even to understand where I need to go next. So can you imagine if you don't speak the language or read the signs? You have difficulty reading, or you have difficulty walking. It's hard to get through a facility. Language difference or negative attitudes towards healthcare providers are based on experience. So have you ever heard of the white coat syndrome? Well, that occurs when, let's say, a patient goes to a doctor's office and they see someone come with a white lab coat. Well, maybe they've had a negative experience with someone with a lab coat. Maybe the person that drew their blood missed and had to poke a couple times. So they're fearful of seeing someone in a white coat. It might even raise their blood pressure. That's the white coat syndrome. It can raise their blood pressure or heart rate. So sometimes a negative attitude is from a negative experience. So you can always talk to your patients about why they feel negatively or why they don't want something. That's good communication. So why do you feel that way? And maybe they can tell you about an experience that they've had. So community and home health care, some more information. So when you enter a patient's home, last on, what was it, Tuesday now, I guess, we talked about home health care. So if you choose to do that, or if you are a home health provider, when you enter a patient's room or home, watch for symbolic objects that may indicate their cultural identity. And I just made a little slip there and I said a patient's room. Well, that's true. I want you to always think of a patient's room as their home, because, you know, they may have their belongings there, right? So you want to always acknowledge and respect their environment, whether it's at the hospital or in the home. And watch for those symbolic objects, and don't just knock them over, or don't, if someone has a Bible sitting on the bedside table, don't put your wash basin on top of that. Be culturally sensitive. Also, assess your patient's health beliefs and practices that might be affected by their culture. So in long-term care facilities, the majority of the patients are white. Well, that's because there's reason for that. Some ethnic groups, such as Latinos and Asians, are extremely reluctant to admit older relatives to residential care facilities. They prefer to keep them at home and care for them, and may only have to admit them when they can't care for them any longer, when it gets too difficult. And it's with great strife that they do admit them, because they have a lot of guilt admitting their loved one when they're supposed to really care for them at home. So many residents of such facilities suffer from functional impairments, such as maybe they've had a stroke, maybe they are blind or deaf or diabetic, severely diabetic. Different cultural groups have the added strain of communication problems and extreme changes in lifestyle and dietary practices. So sometimes if you have a patient who doesn't like the food, maybe you can get an order from the doctor that they can bring food from home or from their culture to make them eat, because we don't want them not to eat, because they won't stay healthy that way. But remember, you do need a doctor's order for something like that. But it's a big change. If you're not used to eating those dried mashed potatoes, meatloaf, and gravy, you'll just not eat. And that's not healthy. So let's talk about some levels of prevention. So there's 3 levels. Primary, where you prevent illness. You prevent the patient from getting ill in the first place, and that's by taking them for appointments, checking the blood pressure, preventing their condition from worsening. Secondary prevention is minimizing complications, keeping their hemoglobin A1C under control, and that's the lab test for diabetics. We'll be learning about that more. I thought I'd just throw that in there, little extra knowledge. And then there's tertiary prevention, which has long-term effects. So they manage the illness so that they can prevent any long-term effects. For instance, let me give you an example. Let's say they have had a stroke. So they're at a tertiary stage, but they don't want to get them where they can't move their extremities. So they do range of motion. They manage the condition. Even though the patient can't move their arm, the family, or even the nurses, I hope, move the extremities so they don't get contractures. The other thing is health maintenance, and those are specific activities thought to promote health. Diet, exercise. Also, practices like the arts, beliefs, customs, folk practices, habits, institution, and all products of human work and thought are created by a people or a group at a particular time. Oops, I'm on the wrong slide. That's the next slide. Sorry. Let's go to the next slide. All right, here we are. So, integrated systems of learned values, beliefs, and practices that guide behavior. These are characteristics of culture. So, whatever your culture believes, that's going to guide your behavior and your practice. It may include arts, beliefs, customs, folk practices, habits, institutions, and all other products of human work and thought created by a people or a group at a particular time. Sometimes patients may take herbs or certain folk remedies and include that in your care, in your care plan. As long as it's okay with the doctor and it doesn't hurt them, then it should be okay. But the doctor needs to know any herbs or supplements that they have at their bedside or that their family members want them to have. So also represents the ideas, beliefs, values, and attitudes that groups of people possess. So those are the characteristics of culture. And I know a lot of you mentioned some of your culture characteristics and behaviors and thoughts in your clinical connection that you did, which you did an awesome job, everybody, on Tuesday. I really enjoyed reading all of them. But it did show me that we have quite a diverse group in our nursing class. And I think that's great, because then you can go out and take care of our diverse group of patients. So some other characteristics of culture are their values and beliefs, and that's the foundation for setting standards and rules of behavior that members of society consider acceptable and proper. And I'm going to throw in a story here. So when I worked down at Cedars-Sinai in Los Angeles, we had gypsies, true gypsies. And one day I walked into a room of a patient who was ill that was a gypsy, and the gypsy family members were under the bed. And I looked and I said, "Why are you under the bed?" And they said, "Well, we don't want the spirit to go down. We want to be able to push their spirit up." Well, that was their belief and their value, and I couldn't say anything against that, right? Except that the floor is dirty. You might not want to be there, but that was accepting of their values. So culture includes learned ways of acting and thinking that are transmitted by group members and that provide solutions to problems. Dietary habits, customs, modes of communication, and that can be verbal and physical. Religion, art, and history are all aspects of culture. So there's some subcultures, and those are individuals within certain cultures who share different beliefs, values, and attitudes from those of the dominant culture. It could be religion, different religions, different clothing that they wear or jewelry. Transcultural nursing is nursing through all the cultures. The integration of culture into all aspects of nursing care. So we want to be sure that we do that and that we appreciate and honor other people's beliefs and cultures. You might think at this time of some of your cultures. I wish we were in person, that I could hear some of your cultures and beliefs, but you did write some of them, so I did get to read some of them, which I appreciated. All right, so there are some similarities And those can be learned, they can be shared, they can be based on symbols. There's also differences that can occur in the same culture, and it may occur among various groups. Nurses should be aware of the differences in these areas and recognize how they affect the wellness, illness, and healthcare practices of their patient. So remember again that a patient of a different culture or belief or language, you have to be sensitive to the way they think, where they place things. Maybe they don't want a man in the room or a male nurse taking care of them. Maybe that's cultural. Don't take it personally. Just remember and honor the beliefs. So many beliefs have developed regarding the onset, course, and cure of disease, as well as the process of death and dying. So some people believe that illness is a type of divine punishment, that they did something wrong in their life and they're being punished for that. Another belief is an individual's balance with nature. Yin and yang is an example. Also, hot and cold theory. So health and illness are influenced by 4 humors that regulate body functions, and that's the hot, cold. So cold can be something that's part of the body, but something hot is an illness. So cultural sensitivity and valuing alternative ways of dealing with health issues as well as spiritual beliefs allow you to individualize care. So by valuing their culture, you can individualize their care. Like I was saying, maybe if you're making out who's taking care of who, you will have a male not take care of a culturally sensitive woman. So we want to even schedule some of our care and our nurses to be culturally sensitive. Avoid labeling patients as difficult or uncooperative because you don't understand their behavior. Maybe, after all, remember they're in a strange place. They may not want to be alone. And so they're fighting to get out of the room. They don't understand that's their hospital room or that they have to be alone. Also, maybe they can't hear you. They can't speak your language. So don't label them as difficult or uncooperative. And even at the nurse's station, you can even put a little label by the light, because you know how some nurses go, "Can I help you? Can I help you?" And if the patient doesn't answer back, they just turn the light off. Don't do that. Go find out what the patient needs, because maybe they didn't understand you, maybe they can't answer you, maybe they don't speak the language. So a label at the nurse's station would help that, but you need to be sensitive to that. All right, I'll tell another story. I had surgery and I could not speak. I couldn't swallow or speak, and I was on a neuro floor, and I rang and called the nurse, and I couldn't. She said, "Can I help you?" It was at nighttime. She said, "Can I help you?" I couldn't answer. I couldn't speak. And they kept saying, "Can I help you? Can I help you?" And I couldn't answer. I wanted to, but I couldn't. So I just had to, I heard them turn off the light. I thought, oh boy, I sure hope they come and see what I need, because I really needed something. And then I wouldn't call unless I absolutely needed to. So that's another thing, that a patient may not call until they're absolutely have to go to the bathroom. So then by the time you get there, it might be too late. So you've got to be sensitive to that. So the more sensitive you are to cultural differences, the more effective your nursing intervention will be. Failure to provide culturally sensitive care can cause stress, and that in exchange will prolong the patient's recovery time, because stress prevents you from getting well. It raises your stress level, raises your cortisol level, which can cause inflammation in the body, and you just can't get better despite the medication. It takes longer. But as a nurse, you can decrease the stress, and hopefully the patient can get well soon. So now we're going to kind of switch gears here and talk about the different stages of life. So young adulthood. So be sure you notice what age that is. Notice in your book, I'm going to find that page. But while I'm looking for that, I'll just tell you it is the 20s, 30s, and 40s. That's considered young adulthood. And the person who made these stages is Erik Erikson. And he introduced the idea that each stage of life is associated with specific developmental tasks to be achieved to advance to the next stage. He divided adulthood into young, middle, and older stages. And then the framework provides a useful way to understand the needs of adults. And I just advanced it by mistake. Sorry about that. So I'll just talk about it. So young adulthood accepts self and stabilizes self-concept and body image. Body image is very important in that age. They're very aware. Maybe it was a football player. Maybe it's just someone who wants to really look nice. Very sensitive to their body image. If something happens to that image, an injury or an illness, it can really make them very depressed. They begin to establish independence from their parental home, and they get financially stable. Also, they begin to assume responsibilities and independent decision making. That can be kind of tough when your kid starts making their own decisions, but you have to appreciate it, right? So now here we are on some developmental tasks of a young adulthood. They establish and maintain a home and manage a time schedule and life stresses, hopefully. They find congenial social and friendship groups. They decide whether to have a family and carry out tasks of parenting. It's happening a lot later now than it used to. Also, they formulate a meaningful philosophy of life and reassess priorities and values. And this can change as you age, right? I think one of you even mentioned that you experienced that. As you get older, your philosophy may change and you become a little less self-centered, and you reassess the priorities that you had once might mean more to you or less, as well as your values. You also become more involved in the community and try to help. Soup kitchen or the Homes for Humanity. So that's a very adult thing to do, right? So let's talk about some health problems. And while I'm briefly talking about each thing here by the slide, I want you to read the book so that you can be familiar. It's really important that you know about these different developmental stages and health problems. So the health problems of young adults, relatively few. The major causes of death in the young adult are vehicular accidents or other accidents, falling, suicide, and homicide. Typical health problems related to stress on the job or in social interactions. So stress and not the ability to talk about it can build up and make you sick. Lifestyle and childbearing. So I know a lot of people who have trouble having children now, and some say that's due to stress. Smoking and alcohol or drug abuse is common. Now remember, about this time we want to talk about tetanus shots every 10 years. So we want to be sure to follow that rule. As adults progress into their late 30s and early 40s, the primary cause of death is injury, homicide, or suicide. Young adults work hard and party hard. Meals may be eaten on the run, and the diet may consist primarily of junk food, so that can be a problem. Diet, not eating the right foods. And also smoking and alcohol or drug abuse. Now those can lead to problems, maybe not at the moment, but later on down the line. Smoking, lung cancer. Alcohol, liver disease. Drug abuse can lead to not just immediate problems, but maybe sharing needles can cause massive septicemia infection that can occur. So, anyway, developmental task of middle adulthood. So what age is that? Well, 45 to 65. So between 45 to 65, according to Erickson, now I know everybody doesn't fit into these categories, but this is what Erickson established. So they have helped growing or grown children become happy and responsible adults. So by teaching your children when they're young, hopefully they grow up to be happy and responsible adults. Balance work and other roles is common in the middle adulthood. And that's tough sometimes, isn't it? Balancing work and being a mother or a father. And then trying to find a little time to play. You're beginning to save money for retirement, putting a little bit away. If you have a job that matches retirement, please do that, because you put a little bit of money in, and if that company can match that, your retirement benefits will double fold. Role reversal with aging parents. So they used to take care of you, now you're taking care of them. That's role reversal. There's also something called the sandwich generation, which is where you're sandwiched around this age between your parents who are older and you have kids of your own. So you're in the middle. Then you want to prepare emotionally for eventual death of parents. You see your aging parents and you have to prepare yourself. That's hard to do, really. I know you think about it, you try to prepare yourself, but I don't think anything can really prepare you. But by thinking about it, at least you are thinking ahead. What would you do so that when the time occurs and that happens, you don't have to think about it. It's maybe already taken care of, or your other brothers and sisters or other family members have talked about it, so someone can take the lead. Also, achieve mature social and civic responsibilities. Maybe you're a parent that goes and helps at the school, or maybe you, again, help at the soup kitchen, or you have some other civic responsibility. Some people are involved in activities in the city. That can be something. Also, you give time and resources to the community. So middle-aged persons who successfully master developmental tasks begin to accept their age and gradually come to value the wisdom gained from living and experience rather than the physical power and strength that accompany youth. So you accept and adjust to the physical changes. So I had to buy a mirror that magnifies because I can't see that well. I think it was God's way of helping me not to have to see all those wrinkles, but I'm adjusting. Anyway, establish and maintain a healthy lifestyle. So in this middle adulthood, you're exercising, you're eating right? You've had to get to this point, but now you're actually doing it. Maybe you're meditating. Maybe you're doing some other exercise is a great thing, and there's many different modes of exercise, whether it be Pilates, whether it be bicycle riding, hiking, maintaining a healthy lifestyle. You continue to formulate a philosophy of life and grow spiritually. And that is a good thing, to grow. We always want to grow and learn. We develop satisfying leisure activities. And it's taken us this long to get proficient at some of these activities, right? We recognize the inevitability of death and prepare for your own eventual death. So that is another thing that occurs. All right. So health problems of middle-aged adults. Actually, they continue to be relatively healthy. But if they do have health problems, there's something that's either sudden or it has happened over a period of time, like cardiovascular disease, and that is the major cause of death in this age group. Now that has built up over a period of time from diet, poor diet, or lack of exercise. So that's why in the younger years you want to start developing good habits. Cancer, now it's hard to prevent cancer, but we know there are some things, breast exams, prostate checks, don't pump gas or not smelling the fumes because that can be cancer causing. Certain foods that we want to avoid that are cancer causing. Pulmonary disease, well, smoking, if you've avoided smoking. Diabetes and obesity, those are some health problems that occur in middle adults. Now, those are things that can hopefully be prevented, but sometimes they are associated and run in the family. Alcoholism, what started out as a fun thing when you're younger suddenly becomes a habit and a problem. Anxiety and depression. Well, the more you have to do and the more people you have to manage and the more roles you have to play, you're bound to have a little anxiety or depression. The secret to that is getting help, recognizing that you have a problem and getting the help, or doing activities to help prevent that. And that can be some guided imagery, some meditation, some activities like that. Also glaucoma. Now that's something that's just going to come with aging. You want to take good care of your eyes. You want to wear sunglasses all the time. Hopefully you can avoid eye problems. Something that's hard to stop is the bone mass. It begins to decrease. Now I'm going to throw this Pilates in there again because it does help prevent osteoporosis. Muscle reduced due to decreased muscle fibers. Well, just keep walking, keep moving. Don't become sedentary. Now that word hasn't really come up in any of these slides, but sedentary lifestyle is a bad thing. We want to always stay active and keep moving, and that will help keep our muscles from decreasing in size and strength. Also, some age-related farsightedness like presbyopia, that's a great word, can develop, and that is a result of decreasing lens elasticity. So early diagnosis of illness helps prevent later complications, we found. So some developmental tasks of older adults, and remember this is age 65 and older now. So they have to adjust, I have to adjust to decreasing physical strength and health change. Adjust to retirement. Maybe you have to stop working. Age 65 is retirement age. If you're older than that, you can keep working. Or if not, you have to stay home, be on Social Security, and maybe find some activities. Finally, you get to garden or do some other activities that you wanted to do. But it's still an adjustment because you're used to being active and busy, and suddenly you don't have that structure. So it's an adjustment. Also adjust living standards to retirement income. You don't have that extra amount. And believe you me, that Social Security income isn't as big as you think it's going to be. Establish satisfactory living arrangements as a result of role changes. Maybe you have to downsize. And that's hard if you're used to living in a larger home, but your kids leave. You don't need that big of a home, so you need to downsize. And maybe you're not the one that hosts the Christmas party or the Thanksgiving dinner. So your role is going to change as the main person, and it's not your house that you go to anymore. Anyway, I'm just giving you some examples. It isn't always true for everybody. This is Erickson's decision to put everybody into these categories. But it does help us understand, right? So emotional satisfaction in relationships with spouse, children, grandchildren, and others. So maybe your children got a divorce, and so you've had to develop a relationship with another person's children. So it's an adjustment, and it's ever changing. Establish an affiliation with members of your own age group, maybe a card group, a group of people of your same age that play cards, or what is it? Not ping pong and not Scrabble. What is that game? Oh, I can't think of it. It'll come to me later. I'm sorry. Now you're going to hear how sometimes I have memory lapses. Bingo. That's it. Bingo. Bingo. It's bingo. So let's move on. Oh, some health problems of older adults. So the major causes of death are related to chronic illness. So an illness that may have started earlier in life and it's chronic. So remember the difference between acute and chronic. Chronic is something you've had for a while and it's not going away. Specifically cardiovascular disease in this instance. Now, if you have high blood pressure or high cholesterol, maybe you've adjusted your diet, or maybe you're on medications. If you've developed cancer, chemotherapy, radiation, but it is a cause of death in the older adult as is cardiovascular disease. Heart attack. You hear sometimes of people having a heart attack in their sleep. And that's interesting, isn't it? They're not being active, which you think is when someone should have a heart attack, when they're under stress. But they think it's due to a change in the breathing pattern when you're asleep. I'm throwing in a little extra here. Your breathing pattern when you go to sleep slows down. Maybe your pH changes, and that may make you more susceptible to cardiovascular disease. Take a drink here for a minute, folks. All right, diabetes. So we know having diabetes, you want to try to keep it under control throughout your life. But if you haven't been able to, you might be suffering from an amputation or your heart disease, kidney disease, eye disease. Diabetes can affect all parts of your body. Other problems adults have would be accidents, falling. Because the muscles get less strong and maybe the vision is less, patients fall as they get older. So they trip more easily. I once had a patient, he was like 75 years old, and he went up on the roof. I mean, he'd always gone up on the roof to do some work. He got his ladder and he went up on the roof and he worked on some tiles there, and his wife didn't want him to do it, but he did it because, you know, gosh darn it, he could. And he did fine, but then he saw the shutter that wasn't right on his house. So he got a little ladder and was just going to go up the little ladder to fix the shutter, and he fell. And he broke his neck. But they found him, and they were able to save him. But accidents can happen, and it is the fourth leading cause of death in the older adults. Now, some common illnesses that can occur would be arthritis, and that would be your bones stiff, swollen joints. GI problems, especially that esophageal sphincter loosens. We'll be talking more about these kind of things, but maybe your appetite is poor, an older adult, that things don't taste as good anymore, so the diet isn't as good, they don't eat as well, they're not as hungry, they're not as active, so they don't get hungry. Like I said, that lower esophageal sphincter gets loose and they might have reflux problems. And then they could have acute or chronic respiratory diseases. And maybe a chronic respiratory disease like COPD can lead to an acute pneumonia. So they can compound each other. Also, benign or malignant enlargement of the prostate is very common in older men, and they say that if a man lives long enough, he's going to get prostate cancer. It is very common. Breast cancer is common in older women as well. So let's try a question. So which of the following is not a developmental task that must be achieved by older adults? I'll give you a minute to look at it. Now remember to notice the word not. So we're thinking what's not normal here. So the correct answer is A. Accept self and stabilize self-concept and body image is not a developmental task of an older adult. It's a developmental task of a young adult. So that's the kind of questions you're going to be having. Good thing we had one now, isn't it? All right, we're going to keep going. We've got more. Oh, yes, we do. So we're going to talk about families now, types of families. There's so many different types now. There's traditional nuclear family, the husband, the wife, the kids, the grandkids. But it doesn't always happen that way, does it? But we still know that that does exist. Then there's the extended family where you have in-laws and the in-laws' families. Then we also have the step-parent family or blended family. So maybe two divorced people marry, and then they have kids from the other spouse, and now you've got a blended family. And then there's the single-parent family, and that can be choice. That can be from divorce. It can be from death. But it's not unusual at all these days to have a single-parent family. And then a non-traditional family can be anything. It can be a gay couple, male or female. It can be bisexual couple. We have many options of a non-traditional family, but the word family is still there because you're still supportive of each other and you love each other, and that's important in a family. So many types, and we can accept them all, right? So there are stages of the family life cycle. So there's beginning families, and the beginning family stage can also be referred to as a married couples or the stage of marriage. A couple different ways you can look at it. Families with young children or adolescents. So it's also not unusual to have the grandparents taking care of the children because the parents have to work. And daycare is expensive, and especially with COVID now, I know it's been hard for a lot of you to have daycare. Daycares are closed, so you rely on your family. Launching children and moving on is another stage. That was a rough one for me. The empty nest type thing where your kids leave home, go to college, move to another city or another state. That's hard. And then families in later life. But sometimes in later life, you end up taking care of your grandkids, so it's kind of a win. That's why you got to take care of yourself. All right, so just a little bit more on that last slide. I want you to note on page 34, table 3.3, the stages of the family life cycle. And so I want you to be sure that you study those stages. Also, Friedman in 1997 defined family as two or more persons joined together by bonds of sharing and emotional closeness and who identify themselves as being part of a family. It doesn't say male, female, right? It's just two or more persons joined together, or more joined together. Also on page 34, I want you to notice the family response to patient illness or injury. Always remember that the best source is the family for support. Okay, now we'll talk about this family role structure. So each member of the family has a role. Usually the one, I'm not going to say the husband is always the breadwinner because that's not always true, is it? Or maybe the husband and the wife are both bring home money, but they both work. Sometimes just the man works and the mom stays home. I've even known of women working and the dad stays home and takes care of the kids. But each member of the family has a role. Cultural Culture and social class usually influence how roles are allocated to family members. But in recent years, it changed. The roles, family functions are carried out through the roles. So someone washes the dishes, someone takes out the trash, somebody cooks. So by giving roles, everything gets taken care of, and that's really, really important when everybody works, or when the mom and dad work, or husband and wife work. Members may fill more than one role, and any member can satisfactorily fill any role in either category. That's a healthy family. You can fill in for each other. Where one lacks strength, another is stronger. So you balance each other out and help each other out. And that's how families help through bad times and good times. So on page 34, the family roles structure. A healthy family may be able to shift roles. That's pretty important to remember, to other members so that the family can continue to function adequately. And that's important too if someone gets sick, right? Everything doesn't crumble. You can fall right into another job or be able to have another role to keep the family together. Sometimes a loss causes that to happen as well. So on page 34 and 35, at the bottom, know the informal roles, especially, I'm going to turn to that page so you're going to hear a little rustling because there's something I want you to know there. So at the bottom of page 34, that last paragraph there, it talks about common informal roles include encourager, praises others' contribution, the harmonizer, and you may recognize these, you may know somebody in your family that's like this. The harmonizer mediates differences among other members. The initiator can suggest new ideas and activities. The blocker rejects everything. They're the, oh, I don't want to do that. Oh, I don't want to do that. Then there's something called the martyr. That's important to remember. The martyr sacrifices everything for the sake of the family. Usually, probably the mom, right? And then, but there's consequences to being a martyr. Because other people tend to slack off, or they might be resentful. So remember the martyr sacrifices everything. Then there's another thing I want you to know. The family scapegoat. What is a scapegoat? Well, it says in your book, the family emotional ills is blamed on this member. They're labeled as a problem member. So that is the scapegoat. Important to remember that. And then the caretaker, that's the nurturer, the go-between, the person that tries to keep things balanced. All right. All right. Look at this. This is big. All right. So let's talk about communication now. Very important. So there's functional communication. What's really important about functional, emotional, and affective, which I will talk about each one of those, you accept another's differences. You know that they don't believe the same you do, but you accept them for what they are. Maybe they don't want to play football, even if you want them to, but you accept them for who they are and what they want to do. Function is what they want to do. Emotional, you want to always accept their emotions as real and not put someone down for how they feel. You can do that through good communication. Effective communication is important. And then if you don't do those three things, accepting others' differences and emotions, you're going to get a dysfunctional communication where there's an unclear transmission of a message. So somewhere, either the giver or the taker of the information doesn't receive it well, and that can lead to dysfunction. So know about family communication patterns, especially functional communication. That's important to know. And remember that on page 35 it talks about communication patterns in a functional family communicate acceptance of individual differences, openness, honesty, acknowledgement of feelings, and recognition of the needs and emotions of one another. I know I've said that a couple times. It must be important. All right, so also some things I want to talk about here on this page is remember that the different stages of childhood, such as families with young children, adolescents, etc., these children will exhibit different behaviors based on what stage they're in. For instance, and this goes along with communication. Yeah, I know I talked about stages, Erickson's stages, but this is more specific that I'm going to talk about here. So, example, teenagers. They tend to show risky behavior and have mood swings. Any of you out there that have teenagers, you know what that's like. Young children, like 5-year-olds, really young 4-year-olds, they tend to be very physical and show physical expressions. They run to people, they love people, they give hugs and kisses. That wouldn't be accepted a little bit later on. You wouldn't be as affectionate as a little kid, right? So early childhood tend to be more affectionate. On page 35, it talks about effective communication involves verbal and nonverbal. Physical gestures of touching, caressing, holding, and looking. And remember, whenever you cross your arms, that is not open communication. You know, crossing your arms is like, huh. I wish I could show you this, but it kind of closes off communication because you don't look like you're receptive. And that can go along not only with your family, but with your patients. So if you act like you don't really want to communicate with your patient, they get it, and they won't communicate with you. All right, so families with functional communication patterns value openness, spontaneity, self-disclosure, mutual respect for each other's feelings, thoughts, and concerns. Dysfunctional communication is the opposite of functional communication. So be sure you read this and understand. It's on page 35, dysfunctional communication, and the patterns of dysfunctional communication. Also on page 35, dysfunctional families avoid discussing meaningful issues or expressing feelings by using superficial conversation. They talk about unimportant daily occurrences rather than the meaningful issues of family life. Again, that's on page 35. There's also a cultural considerations box on page 35. So take a look at that. Cultural aspects of family communications must be considered when determining whether a family is functional or dysfunctional. So take a look at that. I'm looking at it right now. Okay. So family coping. A positive response that family use to resolve problems or reduce stress. Processes and strategies enable the family to maintain its necessary functions. Without effective coping and adaptation, family functions cannot be adequately managed. Sorry if you hear my dog barking in the background. All right, stress. Oh, stress. You know what? Stress is a response to a stressor or an event. Now, stress isn't always bad. For instance, the stress of knowing that a test is coming, what does that make you do? It makes you study more. So it's a good stress, so you can get a good grade. Sometimes I get stressed doing these slides, but it makes me get more prepared. Then adaptation is the process of adjustment to change. How a family adapts to stress and change affects family health and functioning. So coping. If adaptation to stress is negative, the family functions less effectively than if adaptation to stress is positive. So we can all be in some sort of a negative situation. Let's say there was a hurricane or a flood and we lost all our belongings. We have to adapt to the change. And we can look at it positively or negatively. Maybe we just get into the business of rebuilding our lives. Or we can feel sorry for ourselves. So on page 36, it talks about family coping and how a family adapts to stress and change affects their health and functioning. Important to remember. All right, there's some defense mechanisms. I know this is a pretty long chapter. Sorry, guys. Defense mechanisms are ways of responding to stress, usually avoidance behaviors, generally negative. Coping strategies are behaviors or efforts for effective problem solving. They're generally positive responses. You're coping. That has a positive connotation. Defense means, oh, defensive, right? It's more of a negative response. Mastery is the result of using effective coping strategies and the family functions in a healthy manner. Now I'm looking at some, well, I guess it's in the next chapter. All right. What are some defense mechanisms? I want you to remember that. Some coping strategies and mastery. So, coping strategies that families use to respond to stressors change over time with the particular demands or stressors being experienced. Page 36, important to read about that. So coping strategies that families use to respond to stressors change over time. Situations change too. The age of the children change. So the stressors can be worse or less. Page 36. Also, coping responses include internal and external coping strategies. Know what these are and how to differentiate them from each other. So there's a health promotion box on types of coping mechanisms. And on page 36, it has health promotion, internal and external family coping strategies. Types of coping responses: you deal with the situation causing the problem. You attach meaning to the problem. Oh, what could that mean? That can take you down a bad road. Help one another rather than dealing with the stressor or situation itself. Internal coping strategies and external coping strategies. So the use of many coping strategies is generally more useful than using a single coping mechanism for every stressor, event, or problem. So That's like having several ideas of how to cope in your pocket, because different stressors call for different results or uses. So, family nursing care. Stressors experienced by the family. Support or reinforce coping patterns that are or have been successful in the past can help you get through a stressor. What kind of coping mechanisms used and work for your family? How well the family is coping with stress. That can affect, so if you're the nurse and you're doing the nursing care, you want to be in touch with how the family is coping with the stress. Now, some wives, I'm going to use this as an example. This isn't always true. This is just an example. Okay, so let's say the husband is the breadwinner, but he's had a stroke. He's no longer able to work. Well, that's a stressor on the family. And is the wife going to cope with that well when she's never worked? No. And the family will have a tough time with that. You need to understand that. Social worker can get involved. Internal and external coping strategies that have been used in the past. And too much stress puts the family in crisis. We don't want that to happen. But sometimes, a friend of mine a couple of months ago lost their spouse, and then a couple of weeks ago lost their daughter. Now that's a lot of stress, and it can put that whole family into crisis. So it's important to know how well the family communicates. And when you go see your patient, you can see the interactions of the family. Maybe you talk to them on the phone, and you can communicate and find out how they cope, and find out whether it's functional or dysfunctional. So what is the role of the nurse? So family members frequently provide support for patients, but you also need to provide support. So consider the needs of the family members, especially in cases in which there's a serious illness or a threat of death. Maybe they need their pastor called. Assess the relationships among the patient and other family members. The inclusion of family members in the patient care and the decision-making processes help maintain the self-esteem of patients and family. So it's really, really important to always provide the family information, and they can provide you with information. They're the best providers of information because they know how the family works. So also, it's important to include the family in the care of the patient because it helps them feel like they're helping, because a family can feel very helpless when their family member is sick. So if they can help, it helps the self-esteem of the family. And if the patient can help himself, even if it's just turning from side to side or pulling themselves up on a trapeze, it helps their self-esteem. Also provide information that can relieve anxiety, and also knowledge is power. So knowledge, give your patient knowledge, because fear of the unknown is great. It's worse than knowing what's going to happen, because your mind can go wild. Consider the family's influence on individual members as you assess, diagnose, plan, implement, and evaluate nursing care. It's always important when collecting information about families and their coping strategies to first determine what stressors are being experienced by the family, what kinds of coping strategies are used, and how well the family is coping with stress. And that's on page 37. A really important thing to know. Page 37. All right, how about some community resources? Well, there's a lot of things out there. There's groups that can help families cope with healthcare problems. And I'll tell you, let's take an ostomy, patient with a new colostomy. No one understands how he feels except another person who's had a colostomy. So it's really good to call in people who have experienced the same illness or experience. So groups, group therapy. Also informal resources, maybe just a neighbor or a friend is an informal resource. Formal resources might be books, magazines, leaflets, Google. Love Google. Just be sure you use a reliable source. Don't use an unreliable source. Community groups, healthcare providers, and social agencies are a good source of help. So I have one more thing for you guys, and that's a question. So which of the following statements is true about family roles? So I'll give you a minute to look at it. So the answer is A. A role is how one is expected to behave in a situation or what is expected of a person in a certain position. That is the definition of a family role. Okay, I hope you enjoyed this and be sure you read your book. Thank you.